epicondylitis is also known as tennis elbow, and we see this a lot in our patients. It's actually one of the most common sources of outside elbow pain. So what we'll see is patients coming in with pain to touch at the outside of the elbow. You'll get some loss of grip strength, so you might be dropping things more frequently, maybe some numbness and tingling as well into the hands, but mostly you'll feel a lot of pain here and a lot of pain to extend and rotate the wrist and the forearm. So patients, we see this most commonly. So you're more at risk if you are a desk worker, you do a lot of typing, you do a lot of mouse work, or a carpenter, you just are twisting and extending your wrist a lot with your job. You're more prone to get lateral epicondylitis. So what happens with lateral epicondylitis, it's a repetitive injury. More common than not, there's no trauma to the area, so what happens is it's overuse. So that repetitive extending, that repetitive rotation of those muscles right here as they attach to the elbow causes inflammation, degeneration, and then you get some pain and pulling at those tendons. So some things that we'll do in the office to help treat the issue is we'll do some chiropractic adjustments and mobilizations to the wrist, the hand, the elbow, the shoulder, the neck, and the mid-back. And then things that we'll focus on is some soft tissues, so some scraping to the area to promote healing, to decrease some of that tension into the elbow, into those wrist extenders. And we can do some dry needling, some K-tape as well. And then the most important part of the recovery is that strength training. So giving you exercises to do at home to build that strength so that we can lower the chances of those muscles fatiguing and pulling at the tendons. So a lot of what we do is to build that strength to prevent further irritation and further injury down the road. For the treatment of lateral epicondylitis, we do focus on mid-back, neck, and shoulder stability areas. So what we'll do is we'll make sure we need to get proper mobilization and movement into the mid-back and the neck. Take a deep breath in. All the way out. Making sure that shoulder as well as elbow and wrist have proper movement into those joints as well. anybody you know is having pain in the outside of the elbow, please have them give us a call at the office, and we'll be happy to check it out and get them on the road to recovery. So give the office a call at 513-463-3011.